Okay, it is 2:30, so we will go ahead and get started. Hopefully everyone can see the agenda that I have shared. We'll go ahead and get started. I'm going to read the usual information that I have been reading. This is Janine Johnson, Chairperson for the Clarksville-Montgomery County Employee Insurance Trust. Today is July 14th, 2020. This meeting is conducted under Governor Lee's Executive Order number 51, issued June 29th, 2020. Given the states of emergency that have been issued by the federal, state, and local government due to the COVID-19 pandemic, the trust determines that meeting electronically is necessary to protect the health, safety, and welfare of its members, as well as the citizens of Clarksville-Montgomery County. As a reminder, all votes will be by roll call. Please voice yes or no by each trust member, and voice votes together is not acceptable, nor is showing of hands. And we are recording the meeting, and that will be posted on our website Friday, July 17th. So we will go ahead and do a roll call. Okay, Marcia Demarest.
Present.
Mark Vanasak.
Present.
Amanda Beck. I hear Amanda. Oh, there. Oh, you're on mute, Amanda.
I'm here. Sorry.
Thank you. Tommy Butler.
Present.
Charlie Hall.
Present.
Leslie Helmig. Do I have Leslie? I haven't.
I'm here. It was
Okay,
muted.
there we go. I hear you
Okay.
now. Thank you. Okay. Donna Mahoney.
Present.
Tim Swaw.
Present.
Jeffrey Taylor.
Here.
Thank you. Kimberly Yarbrough.
Present.
Kelly Jackson.
Present.
John Smith. Do I hear John? If John is here, he must not seeing him. Okay.
Janine, John can't be here today.
Okay. Thank you, Donna. Ed Long.
Here.
Thank you. Michael Johnson.
Here.
Thank you. Kay Rye.
Present.
Thank you. And Mary Thomas.
Present.
Thank you. All right. Well, we definitely have a quorum, so we will go ahead and get started. First item on the agenda is the review of the June 9th minutes. And I know Donna did send those previously out to everyone.
This is Mark. I move to accept the minutes.
Thank you, Mark.
Second.
Okay. And who did the second?
Jeff.
Okay, thank you. All right, so I will go through and we will do another, affirm that. Okay, Marcia?
Yes.
Mark?
Yes.
Amanda?
Yes.
Tommy?
Yes.
Charlie?
Yes.
Leslie?
Yes.
Donna?
Yes.
Tim?
Yes.
Jeff?
Yes.
Kim?
Yes.
Kelly?
Yes.
Ed?
Yes.
Michael?
Yes.
Kay?
Yes.
And Mary?
Yes.
Okay, thank you. So minutes have passed. All right. Next item we have is Epiphany RX plan recommendations. We've got Ms. Johnston here, and hopefully I will go ahead and set up share so you can share your presentation.
Great. Can you hear me?
Yes, we can. Thank you, Christine.
Great. Let me share my screen. Can you all see my screen?
Yes.
Yes.
Okay. So thank you for having me again this month. This is a follow-up to the items that we discussed last month. I know that we tabled a couple of the recommendations, and so I wanted to bring those back, and I had the opportunity to answer some of the questions from the trustees, and so I feel free to ask any further questions. But basically, we wanted to update, well, we have 2 plan recommendations, and we wanted to provide you an update on the expansion of the medical carve-out program. So the first recommendation is to look at what we are calling the non-essential health benefit. But basically, this is allowing you all, within the format of the Affordable Care Act, to be able to deem certain drugs to be non-essential. It doesn't mean that you won't cover them, and it doesn't mean that the members can't get it at a reduced cost. But by doing that, what we're able to do is take advantage of some additional copay assistance monies from the manufacturers. When a drug is determined to be non-essential by a formulary tier, the manufacturers offer additional copay assistance available to the program. Now, Clarksville is taking significant advantage of the copay assistance program, so this would be just additional monies. The other reason that this would offer savings for Clarksville is that because of your low out-of-pocket amount for your plans, we are able to get copay assistance for these patients even after the member has met their out-of-pocket amount. So there's some advantages to the plan here. So when we look at it, you do have 2 patients that are on a drug that on our formulary is considered non-essential. We would continue to cover these drugs for these 2 patients. But because they would be now, if you would to adopt this program, be considered non-essential, we would be able to go pursue additional monies from the manufacturer and be able to save the plan. Just on these 12 claims, it would have saved the plan an additional $102,000. So for these 2 patients, we're able to get about $12,500 per month for additional copay assistance. So you can look at the annualized amount. That's about $25,000 a month for these 2 patients. So it's a significant amount of money savings. Trikafta, just so you all know, is a cystic fibrosis drug. So these patients are on this medication for their life. It is a very effective medication, so we do want to continue to make sure these patients stay on it. So there were some follow-up questions about this program from last month's meeting, and I just outlined the responses to these questions here. So we do have 2 patients that would be impacted by this. In order to implement this program, you would need to make modifications to the SPD to add the language that refers to this non-essential health benefit. And the only implementation timeline is because you need to make a material modification to the SPD, we would need to provide 60-day notification. So we would need 60 days to implement the program, but we can do it at any point in time. Any questions about this program?
So, Christine, as you indicated, we would need to modify our summary plan description in order to move forward with this, correct?
Correct. There's an additional paragraph we would need to add.
Okay. And normally, whenever we have done that, we have voted to make that change. The trust has, would never change our plan description without bringing that before the group and voting on that. Chris or Kim, do you have anything that the trust members should consider in addition to what's been presented?
Well, we just think it's a very proactive program, and the trust has always been proactive, and anything we can do to reduce costs now is going to help offset cost increases in the future. The other thing I think we can be very confident about is that Epiphany's proven to have been able to implement these programs without member dissatisfaction and with a member's health at the forefront. So it would be our recommendation, if the trust agrees, of course, to move forward with implementation of this program.
Do I have any other questions about this? And Christine, Epiphany would contact both of these members and coordinate everything so that it wouldn't be additional work on our employees' part, correct?
Yeah, they would need to enroll in the copay assistance program, but I think these 2 patients already are, so we would be able to piggyback on that. I did want to note, and I failed to do that, is that currently we have about 20 drugs in this program. We are constantly looking to expand the drugs that are included in this program as these new high-cost drugs are coming to market. to help. So it's an effort to also get ahead of that. But currently you only have 2 patients that are on the drugs in the program.
And is this a new one? Is this one that we were contacted about maybe like last fall before it had been approved? Is this the one I'm thinking about? I don't know if Amy and Donna remember. I think we were contacted by possibly a parent about this one.
Oh, this drug. Yeah, this drug was just released to the market last fall.
Yes, that was the one.
Yeah, and it's a very good drug. The clinical studies are very, very promising for this. Patients on this drug are, cystic fibrosis patients used to not live very long, but now we're seeing actually 60-year-old cystic fibrosis patients.
And so the trust has a planned savings in it, but the members are not impacted because they are participating in the copay assistance program. Is that?
That's correct. They wouldn't pay more than $5 on this particular drug per month.
Any other questions?
I'll make a motion that we move forward with this program.
Okay. Do I have a second? That was Tommy with the first. Do I have a second?
This is Mark. I'll second.
Okay. Christine, do we need an effective date on this?
So if we were to make the decision today, the effective date would be, I would say we would want to do it on 10/1 to allow for the changes to the SPD.
Okay. Tommy, would you like to modify with an effective date of 10/1?
I would like to make a motion that we implement this program with an effective date of 10/1, and this is Tommy.
Okay. And Mark, you continue to second that?
Yes, ma'am. I'll agree to that.
Okay. Anyone else have any other questions before we vote on this? Okay. If not, I will go ahead and Marcia?
Yes.
Mark?
Yes, ma'am.
Amanda? Amanda, did I hear yes? Okay, thank you. Tommy?
Yes.
Charlie?
Yes.
Leslie?
Yes.
Donna?
Yes.
Tim?
Yes.
Jeff?
Yes.
Kim?
Yes.
Kelly?
Yes.
Ed?
Yes.
Michael?
Yes.
Kay?
Yes.
Mary?
Yes.
Okay, thank you. Motion has passed.
Thank you.
Was there anything else that you needed to present on today, or was that it?
I have 2 more topics.
Okay.
Yeah.
Mhm.
Okay, so the next program is, and you all are familiar with our copay assistance program. We have expanded this program to include additional high-cost brand drugs like Eliquis and Xarelto. We have also modified our enrollment process in this program to do a lot more outreach to members to make sure there is no negative impact. And so what we're doing is a multi-pronged communication approach where we would send them a letter, letting the members know that they need to enroll in the program. In addition, we follow it up with a phone call and an email address, or email if we have their email address. And then also we're doing a daily review of any rejected claims to work with the pharmacies to resolve any issues related to the copay assistance programs. We do, before we allow the claim to process, we do ensure that the member is enrolled in the copay assistance program. So we do work with the pharmacies to make sure that that happens. So a little bit more hands-on with the enrollment process, but we have expanded this program to additional drugs, high-cost drugs, which we rolled out to our clients on 7/1. It's been actually a very low noise event, so we rolled it out to all of our other clients. When we look at the impact for Clarksville specifically, it is we would have 489 active members in this program. The savings opportunity after our fees is about $385,000. That's an annual savings amount. And so we could turn this program on if you all would like on September 1st, because we would just want to have adequate time, which we would like to have 30 days to contact the members and get them enrolled in the program. So again, this is one that I'm asking for the trustees to make a decision.
And Christine, this is just expanding the list of medications.
It's expanding the diabetes program that we already have in place, yeah. And you all were one of the early adopters of that program. We appreciate that.
So how would this change in our summary plan description be different than what we've already just voted on for that other medication? I just want to make sure I'm understanding.
Good question. So your SBD already accommodates this program, so this would not require any additional updates to the SBD, because currently in your SBD we have language that states that monies that are paid by manufacturers do not go towards the member's out-of-pocket amount, which is what we need to describe. The other one is what we're putting as a non-essential health benefit. Essentially, it's a separate benefit or tier of drugs for just that subset of drugs. So that's why we need to make the modification to the SBD. So you would, for this program, you don't have to make any SBD changes.
So what is it that we're deciding on then? I guess I'm sorry.
If you want to expand to the program to these additional 489 patients, because we would be outreaching to the members and we want your
Okay.
approval given the number of members that would be involved.
Okay. Chris,
And
do
so,
you have any feedback for the trust members on this one?
I say go for it. Almost $400,000 right there. And again, I don't think that you're going to have any noise. Epiphany's proven the sensitivity, and of course, we think there'll be good health outcome.
So this would, from what I'm understanding, this would not be a requirement for a change in the SPD. Not sure that we would need to do an additional vote on this. Does anyone have any questions about this? Everyone?
yeah, so the members that are currently in this program are, did you say those are the diabetes patients, or you're wanting to add in, I guess I'm not sure I'm tracking exactly the difference between what we're currently doing and what we're trying to decide to do.
Sure. So currently what we do is the specialty medications and the diabetes medications. Those are really the larger opportunity of savings. And since we've been able to roll those two programs out, we've looked at expanding this program to other high-cost brand medications, specifically like asthma medications, some high-cost anticoagulant medications like Xarelto and Eliquis. And so it's just an expansion of the already existing program, but to additional drugs.
Okay. And then this is saying that right now where they're getting manufacturer rebates and that's going towards their out of pocket or towards their deductible, this would not be going towards their deductible. So basically they're not getting, so right now they're not having to pay it, but they're getting the benefit of those funds. Is that correct?
Exactly. Yeah, and exactly. And so what we also do, we do that, and then in addition, we know the maximum amount each manufacturer will pay for each drug per month, and we present that at point of sale to try to maximize the funds we can get from each manufacturer. So in addition to the application of the deductible, where we only apply the monies that the members actually pay, not the monies the manufacturers pay.
Okay.
So the employee in the past was benefiting from it appearing that their deductible had been met because the manufacturer was paying that copay, but in reality, the employee had not paid that deductible.
Exactly. Exactly.
So this is truly requiring the employees to pay the deductible out of their own pocket, not from the manufacturer's pocket.
Right. Mm-hmm.
Any questions on that? Okay, I don't think that we need to make a motion on that. We've already approved that, but we're just adding additional drugs which will then have an additional 489 impacted members at this time, correct?
Correct.
Okay. All right. So
Okay, so we'll move towards the 9/1 implementation date, and we'll start sending letters out at the beginning of August to the members.
Okay.
Okay.
Thank you.
And then the last item I wanted to update you all, this is just for informational purposes, but it's a really exciting opportunity. We've been working very closely with Tommy and Charla on taking advantage of leveraging the on-site clinic. You all have a really unique opportunity there at the on-site clinic. It's a great opportunity for employees to have access to care, but also we've looked at any opportunity we can to try to help you all save on the medical side related to that with that clinic. And so Charla has been really a great partner, as well as Tommy, in trying to identify patients that could possibly benefit from the clinic. And so first of all, we first looked at Remicade. And so Remicade, you currently have 14 patients on this drug. And it's an infusion medication that the clinic is able to support. And so I know that last week you all began an expansion of the clinic. And so because of that, we're able to handle these additional patients on site. And we supported you all with some training from the manufacturer on how to administer this medication, and also some, helping with putting you on some contact with some providers of some furniture and those sorts of things. But we've been able to partner together to come up with some opportunity here. And so currently, you guys are spending about $500,000 in Remicade a year for these 14 patients. We think after implementing this program, we're going to have an annual savings to the plan of about $438,000 by having these medications administered within the on-site clinic. And what we're going to be able to do is take advantage of not only the copay assistance and rebates that are available, but also we're going to switch members to the biosimilar that's available. That's like the generic medication of Remicade. And then also by changing the site of care to a lower cost site of care, we're able to take advantage of savings for you all. And also, a lot of these patients are going to Nashville currently for their treatment, so they're also being able to get their care locally, which is a huge advantage also. So we looked at, on the next slide here, we looked at other drugs. Originally, we were doing Sandostatin, which is the one patient that I reported to you all last month. We have an additional Sandostatin patient we've identified. And then we also have the Remicade patients and some other drugs that are able to be administered at the on-site clinic. We also have the success that I reported last month for the Fabrazyme patient. So when we look at the program savings, we estimate an annual savings of about $613,000 for the drugs that will be administered at the clinic. And then we have already realized a savings of about $176,000, and that's just for a couple months of claims for these two patients. And so a total of 31 patients that will be impacted by this, with a total of $790,000 in savings. So I love this story because Tommy and Charla are always coming to me saying, hey, can we do this? Can we do that at the clinic? And we are able to partner really well with you all to come up with some real savings here.
Okay, that is very good news. And again, a special thanks to Tommy and Charla for always thinking outside of the box and figuring out how they can make this happen, and always looking for ways to have savings, especially savings that then turn out to be a convenience for our employees.
Mm-hmm.
Is an excellent option. So does anybody have any questions about this?
This is Mark. I've got one question. Did I hear you say, Christine, that under this proposal, those 14 patients on Remicade will be required to switch to the generic form?
Well, we will partner with the farm or the physician to the prescribing physician to see if they would think it's appropriate. Now, Remicade and Inflectra is the biosimilar, and it has been proven to be clinically equivalent. And so we don't see why we wouldn't be able to switch them to Remicade or to Inflectra, but yeah, we would need to work with a physician to do so.
Okay, I just wanted to make sure that we weren't forcing their hand, that the decision to switch to the generic will be either the members or their doctors will make that decision. But these realized gains that you're estimating are based on the fact that all 14 do switch. Is that correct?
That's correct, but most of the savings is actually coming from the site of care savings, but a lot of it is from the moving to the biosimilar.
Thank you, ma'am.
Any other questions? Okay, well, thank you, Christine, for this update. I think that was it, correct?
Yes, that's all I have. Thank you.
We appreciate your time. Have a great afternoon.
Thank you. You too. Take care. Bye.
All right. Okay. Let's see. Next item on our agenda is on-site update. Tommy?
Yeah, I think Charlotte has a few things.
Okay. There's Charlotte.
All right. Well, our numbers are getting much better. We are definitely seeing that we're increasing. So a good case in point is June. We saw this month 1717, where our highest June ever was last year. It was 1956. So we were shy about 240 patients or so. So we're getting back towards normal, and that feels good. Part of that is telehealth. Since we've implemented telehealth in the clinic, patients love it. Our providers love it. And it really does make it a nice convenience factor at the clinic. So we have a lot asking us for that. So we're proud of that. We are also excited because our licensed mental health person does start Monday. Her name is Stacy Fye. We've been inundated with calls and requests to get her started now. They want to have an appointment with her. So we know that's going to be good, and we're excited about offering her services. She's going to try to focus on being available when the patients need her most. So she'll work a lot of evening and Saturday hours, and we're excited because that's going to help a lot of people and families. We also are really excited about infusion. That's going to begin August. It's actually going to be the 3rd. It's a Monday. We're going to do a meet and greet for the patients and their family, and we've been working very hard on getting that infusion area ready. So we are laughing because we had a patient today that's so eager to start that she scheduled her appointment. So she's going to see us on August 7th. So she's our first one to actually schedule. And we have 21 left to schedule for the month. So we're getting there. But we're excited because we know that's going to be not only a savings opportunity, but we want it to be like the most pleasant experience ever for these patients. They're given a lot to come here for us, and we're going to make that a nice experience for them. So we're excited about that. We hope it's seamless in a transition. And the last thing is we've had 2 full-time staff members that have resigned. One was a medical receptionist and one who had to leave, and one was a nurse who took a different position. So of course, to continue with the savings, we're not hiring at this point. We're going to try to do as much as we can so that we can keep on offering savings opportunity due to COVID-19 and just work a little harder. And hopefully once those savings and the time period maybe will stabilize enough where we can kick back and offer those positions if we need it. But for right now, we're choosing not to hire. I think that's about it. I think that's all of that.
Okay, thank you, Charlotte. Appreciate all the work again you guys are doing with the infusion. That's awesome. Thank you. All right. Next item we have is COVID-19 telehealth funds. I think that's back to you, Charlotte.
So we had an opportunity to get, of course, some savings, some more money because of telehealth. Unfortunately, the time period has closed. They had too many people that asked for money. So they shut off the period. And so what we're doing is we're ramping up and going to be the first ones to apply if that money ever becomes available again, because I'm sure they saw a stampede for that money. And so unfortunately, we're not there yet, but we will be the first ones to apply if they open up the door again.
And that was a federal like grant type. Yeah. And
right.
We know there were a lot of those types of programs that if you didn't get in the very first day or maybe even the first 6 hours, the money was gone. Mm-hmm. So I know Charlotte and her team will look, and if we see that opportunity open up again, we will definitely try. So thanks for that update, Charlotte. I know you put a lot of work in preparing, so we'll be ready in case they offer more money in the future. Okay, let's see. The next item is COVID-19 medical plan benefits monitoring. Chris?
Okay, so now on that one there, that was something that we discussed at the last meeting. I think it was supposed to be taken off the agenda.
Okay.
Because the trust voted to maintain the current level of benefits and not expand to no cost share for treatment.
Okay, so then we'll move on to the next item, number 5, the telehealth services update. I know you have some information on that.
Yes, we do. Everybody's aware that as the result of the COVID pandemic, the trust plan was temporarily amended to include virtual visits and phone consultations with providers, basically because of the concern of infection and so forth. And so typically to have telehealth under a medical plan, you had to contract with a telehealth provider. Blue Cross expanded that service and did not require you all to contract with a telehealth vendor. And therefore, the provider's network cost or what would be billed to the trust's plan. So our recommendation is once the pandemic is over, that you all, Blue Cross is going to allow folks to continue that program. Our recommendation would be to terminate the telehealth expansion at that time, simply because you all have the on-site clinic and we think there's the potential for overutilization and plan cost increase. To give you an example, let's just say, this is a simple example, but let's just say that I have poison ivy and I can pick up the phone and call my doctor, or I could either go to on-site or just wait till it went away. And so if it's easy enough just to pick up the phone and call the doctor, once the deductible's met, you can just continue to call the doctor for anything. So we do think there's the potential for overutilization there. The traditional telehealth program would be where you all would contract, like for instance with Blue Cross, you would pay a per employee per month capitated fee. Typically it's around 40 cents. So that would cost the trust plan about $20,000 a year. And then the member would actually incur a $40 virtual fee. And that, again, that happened to us personally. My wife picked up the phone. She was feeling bad over the weekend. She called in telehealth. TVA works through Blue Cross. And her comment to me was, well, gosh, Chris, that costs $40. And so my comment to her was, well, can you imagine if you'd have gone to the clinic, it would have cost you $140. But that's the program that we think if the trust, thinks that they need a telemedicine option, we think you need to go back to the program that you had several years ago. But again, it's our recommendation to not expand the telehealth. And one last point, the utilization was so low in the past that you all terminated that program. So, with on-site, it's our opinion, you probably don't need a telehealth option in the future.
And again, this is not recommending that on-site stop telehealth. That we could continue to do that, but this would be for part of your Blue Cross Blue Shield benefits. And at this time, we really don't need to make a decision since we're still under the pandemic. And what we can do is continue to watch this and then, revisit this in the fall, like maybe November timeframe, and see where we're at then. But this is good information for us. Does anybody have any questions on that? But again, at this time, we're still allowing it. And I think that is appropriate considering the current situation. But we do have some advice and suggestions from our consultants regarding whether or not we were to continue that. I don't think any action is needed at this time, correct? Because we have told Blue Cross that we're keeping this for the time being, but we will cancel at any time if we choose to.
That's correct.
Okay, all right. Any other questions? Okay, thank you for that update, Chris. Let's see, next item on the agenda is the health savings account update. We were looking at that contract, and for those of you, this was something that we started last year. So it's been a while, but this is which would allow employees to elect the higher deductible plan and then put money towards a health savings account. And we did select a vendor. We did not sign the contract last year. We still have not signed the contract. As we were working on it this summer, and as we get closer to the school year starting, I began to have concerns about trying to implement a new additional benefit that will require employees to attend meetings, to have a better understanding. And I don't feel that this time, with the stresses and challenges we are facing with COVID-19 and starting the school year. And then also I had talked to Tim because I wanted to make sure, how the county felt. And just as for the other members, the county is currently looking at their own claims data, and which I think is wise to do. I think they've done that maybe about every 5 years, and they may consider not pulling out of the trust. So I just did not feel that at this time it would be wise to enter in that type of agreement where both the county and the school system were in that contract together. So I think it's something that we can continue to hold on and revisit again next spring. And Chris has shared that information with the vendor, and they do understand. Like I said, there's a couple of reasons there that I don't feel it's really wise for us at this time to take on an additional complicated benefit, although I think a very good benefit, but somewhat complicated to administer. So does anybody have any questions on that? Okay. All right. ABA therapy concerns of employee. If you'll remember, at our last meeting, we did have an appeal. And at that appeal, it was for ABA therapy. We have an employee who is asking us to increase that amount. And we did vote against that. And Amy did share that information with the employee. You should have a sheet there that was sent to you, and the employee did send Amy an email. I just wanted to share that all with you. I did respond to the email explaining to her that it obviously was a very difficult decision for us to make, and part of the decision-making process we do use is the overall cost of different options that we add to the plan in an effort to keep our premiums down. And I did respond to her. I've not heard anything back, but I did want you all to be aware that this employee was still not happy and wanted to know if there was any other appeal options, which I explained to her there was not. So I just wanted to make sure you were all aware of that and that you could see her email. And she was very disappointed, which I understand that. So does anybody have any questions on that? Any comments? Again, I know these are very hard decisions that we all have to make. If I don't see any questions, we'll move on to new business, the financial statement review. Marcia?
Unmute myself. Do you want me to try to share that? You know how well I do at screen sharing?
Well, everyone has a copy of it, so.
Okay, good. That's probably best. So we do have in the May Insurance Trust financial for this month. We had total assets of $25.6 million and liabilities and fund balance of the same amount. The fund is in balance. Our fund balance for the year, or as of May, is $20,815,772.38, which is up about 2.3, a little over 2.3 million from the month before in April. And of course, we know some of that was due to people putting off elective procedures, but that reflects a balance of about 3.84 months of reserve, which is pretty much consistent with the prior year. We had the second page there is our bank reconciliation, and so that is reconciled to the trustees report. The third page there shows the number of participants by school, county, retiree, and COBRA. And then overall for the medical, which is on page 4 there, we had expenses for the month of $3,780,047.15, as opposed in comparison to our revenue of $6,222,461.38. So we had an increase in the month related to that. And so overall kind of remaining status quo with where we've been for at this time in comparison to prior years. If anybody has any questions, I'd be happy to answer.
No questions? If not, I'll entertain a motion.
This is Mark. I move to accept.
Thank you. Do I have a second?
Amanda Vick, I second.
That was Amanda.
Yes, ma'am.
Thank you. Okay. Any other questions for Marcia about the May statement? Okay, we'll go ahead and vote. Marcia?
Yes.
Mark?
Yes.
Amanda?
Yes.
Tommy?
Yes.
Charlie?
Yes.
Leslie?
Yes.
Donna?
Yes.
Tim?
Yes.
Jeff?
Yes.
Kimberly?
Yes.
Kelly?
Yes.
John? I'm sorry, he's not here. Ed?
Yes.
Michael?
Yes.
Kay?
Yes.
Mary?
Yes.
Thank you. So that does pass. All right, experience reports. Chris? And I know these were sent out ahead of time also.
That's right. I'll take it off mute and maybe you can hear me. Okay, so the medical plan report format's consistent with the previous exhibits. And you all know the drill there. And page 1 of the medical plan experience report, the first page is June. And you can jump right down to item G, the loss ratios for June were excellent. Year to date, just south of 97%. And so if you go to page 2, you'll see that they had a real low claims month for May. So that's good news. Now, as we all are aware, those costs will probably tweak back up, but the medical plan's in real good shape.
Great. Thank you. Any questions for Chris on that? If not, we'll move on to the dental plan experience. Now that should be really good too. I don't think anybody could go to the dentist for a couple months here unless they had an emergency, right?
That's right. So
Might make money on us this year.
well, if they do, we'll request a rate reduction. So you can see there, this is for, of course, the school system only, and the June loss ratio all the way out to the bottom right's at just a little above 76%. And of course, the previous month was a COVID month, a very, very low loss ratio. June tweaked up a little bit, and I think it'll continue to a little bit as people end up getting back and having their dental work done. But again, we think the dental plan's loss ratio is real good where it is.
Great, thank you. Any questions for the members? Okay, we will go ahead and move on to the next item, which is IVF appeal. Chris, and I think everyone was sent an item on this.
Yeah, if everybody would kind of grab that exhibit. I don't know if you've had a chance to look at this. This is another one of those areas that's so difficult to really to research and then communicate, because I know the sensitivity of us all, you know. And basically, you had an employee that inquired about expanding the group medical plan. Again, it would require an amendment to cover fertility treatment. Fertility treatment's typically excluded from group medical plans. You can see right there at the top bullets, your plan excludes, the state of Tennessee plan excludes, Blue Cross's insured plans exclude, the predominance of group medical plans exclude, though the Metro Nashville Public School Plan does include a provision for fertility treatment. The Metro government plan does exclude, but the teacher's plan the public school system plan does include. If you all wanted to consider amending your plan to cover fertility treatment, the actuary, Blue Cross's actuaries indicate that they think the estimated annual cost increase would be about $287,000. So we've got a few additional bullets right there, kind of gets to our point that we certainly understand that there's consistent a request for expansion of medical plan procedures. Your plan does provide very comprehensive coverage. And of course, the employee's cost share is very, very affordable. And it's just a constant struggle, but it would be our recommendation to maintain the current exclusion for fertility treatment.
And just so the members, normally we don't look at what does Metro Nashville plan offer, but this employee specifically indicated that they did cover it and has said that, if we don't cover it, they may choose to take a job at Metro so they can have this done. So that's how, and so we did verify. So that's why you do see the information there for Metro. Just wanted to explain that because, again, that's not something you normally see in our explanations. Any questions on this?
Janine, this is Amy.
Uh-huh.
And if I could just add, I think you and I spoke of this, but it's only the certified staff that would be eligible for the IVF. It's not all employees. So classifieds, we would have a division there if we were to do exactly what Metro has done.
Okay. Yeah. I'm guessing it was something that must have been possibly a part of negotiations at one time with the Teachers Association at Metro. Thank you, Amy, for including that. Any questions, comments? If we did want to add this to the plan, we would need to have a motion and a vote on that. If I don't make a motion, then did I have a question?
From Charlotte.
Yes.
I wondered, I was going to say we get a lot of people that ask about fertility labs and they're extremely costly. And so at the clinic, we try to provide the same service that is covered by the insurance. So I'm not sure if that was calculated into the amount or not, but the labs alone are quite costly. So I guess that was probably just a note to think about.
Okay. Thank you. If I don't hear a motion, then that will mean we will not add it to the plan. And then Amy would be notifying the employee. Okay, no motion. Okay, then we'll move on to the next item. Next item is the Cori Fee. Always just like to make sure everyone realizes this is a fee that we are required to pay each year as a part of the Affordable Health Care Plan, which has not been terribly affordable for the insurance trust, but I always just like to say that every year. I think there's a lot of great things for the Affordable Health Care Plan, but it is costly to the insurance trust. But again, some very good things for members and for the public. But so this is due on July 31st. I do think the amount's going down a little bit, isn't it? Was it kind of like a gradual? Doesn't seem like it's as much as it was in previous years, but it's $24,000. So it says that it was supposed to sunset last year, but has been extended for an additional 10 years. Isn't that special? So again, I always just want to make sure everyone's aware of that. And Donna always makes sure that we get that sent out. So thank you very much. Any questions on that? Okay, I will get off my soapbox now. All right, monthly claims. Everyone should have a little sheet on that. Just want to make sure that everyone reviews that, kind of give you an idea of where our monthly claims are and how they compare to previous years. Again, we know right now in May and June, a little bit lower than usual, but you'll see in June they are starting to go up. It looks like we're at 4.2 million, but May was at 3.4 million. So that's probably the lowest we've had in maybe several years. But we know that we'll start catching up to that. So That is all we have on the agenda. The next item is to schedule another meeting. We do not have any appeals waiting for us, so I think this could be, we could wait a while for another meeting. Do we want to look at October? I think we could go through the month of August and September, unless, Chris, is there anything that we're going to need to, are we going to need to vote on reinsurance?
We are going to need to vote on reinsurance, and we should have, unfortunately, there's nothing available that's firm at this point, but we should have some information by the end of this week about the reinsurance. So typically they like you to lock the plan provisions in. When is it? Normally the end of the first week of August, something like that, or they have the right to look at claims information and they could update their proposal. So I don't know, we might be able to do that, Janine, if you wanted to do that by, an email vote or something.
No, our bylaws do not allow that. We don't have an option for an email vote. So let us know, when do you think that we're going to need to have another meeting? Did you have a question, Mark?
Yes, ma'am. I was curious if the timeline works. Are we able to do a digital, a quick call digital meeting before August 29th, before the state executive order runs out, so that way we don't have to drive in town for a quick meeting?
Yeah, if we could have it, Chris, what are you thinking that we need to have a decision by? Because we can have another Zoom meeting.
I think we would need, Kim, what's the typical cutoff there? Claims are available usually from Blue Cross, what about the end of the first week of the month? So we'd want to make a decision prior to August 6th. And if we had a meeting, we probably could condense the discussion. We'll have a bid the plan to make sure that you have the most competitive provision, and a meeting probably would take 10 minutes or less.
Okay. So we're looking at possibly the week of August 3rd.
Or you could do it sooner, Janine, whatever would work best for the members.
Mm-hmm. I'll entertain some dates here. I was looking at possibly the 4th. I know that's before the teachers you guys are all back on your calendars, and we had a Zoom. We could do like a 2 o'clock or a 2:30 like we did this time. I'm seeing some thumbs up. Okay, why don't we shoot for August 4th? Okay, and we'll do 2:30. Does that sound good? And we will be able to do that via Zoom. So it's a little bit easier. Okay, so August 4th, 2:30. And I'll make sure and get that invite out to everybody. All right. Okay, and that'll work for Chris and Kim. That'll work good for our reinsurance. And that ideally should be a pretty quick meeting, like say probably 15-20 minutes max. And then unless we have something else, then we probably after that wouldn't have to meet until more like October timeframe, October or even November actually. So, all right. Well, again, I appreciate everyone's time. We'll go ahead and adjourn the meeting. And again, thank you for joining us via Zoom. And we will see everybody on August 4th then. Have a great afternoon. Bye-bye.